More than 100,000 Tennesseans are at risk of losing health coverage as a result of cuts to TennCare in President Trump's budget plan. The state sued but lost the case. Now, the state plans to begin removing people from TennCare as soon as the Affordable Care Act credits expire at the end of the year. Here to talk more about resources available to help those affected right here in Shelby County is Dr. Scott Morris, the founder and CEO of the Church Health Center. Doctor, welcome back to 3 at 3. Good to see you as always.
Always glad to be here, Alex.
My pleasure, for sure. Let's talk about the impact of the big, beautiful bill, especially as we go into the end of the year and what's likely to come in 2026.
Well, so all this conversation about health care that led to the government shutting down for a month, that's what this is about. By the end of this year, there's all this federal subsidy around health care that will end. And at this point, it's hard to know exactly the number. I've heard a Baptist Hospital senior executive quote the number 161,000 people in Tennessee. The Tennessee Justice Center thinks it could be as much as 250,000 people in Tennessee will lose their health insurance. Those are big numbers.
Those are huge numbers.
Yeah.
I mean, how concerned are you about that? Again, I know for so many years, for so many folks, especially here in Memphis, Shelby County, Church Health Center has been that gap, that safety net for a lot of folks. Will this put an additional strain on you?
Well, yes. I mean, a significant number of those people will live in Shelby County. The problem is, there will be people who will lose their TennCare coverage, but then there will be people who will no longer be able to afford a marketplace insurance program also under the Affordable Care Act. The price of that is going to go up significantly, and the issue is that they could still pay for it, but it's going to be beyond their ability to pay for it.
Wow. When it comes to state lawmakers, do you think they realize the impact of what will be going on here? How many lives will be affected by this?
Truthfully, I think very few people realize the number that we're looking at, and but maybe something's different's going to happen, but I don't see where that's going to make any big differences. This is all at the federal level, and not really so much at the state level. It will be up to the state to figure out, what do we do now?
Scott, a lot of people will also assume that, well, we're dealing with maybe things that happen in larger cities, like the city of Memphis, maybe Nashville, for example. But what about the rural communities or smaller communities as well? Will they be impacted by this also?
They will be hit in a significant way. I mean, the people who are covered through the Affordable Care Act right now are people all over the state. This is not just about poor people. It really does hit sort of lower middle class folks the hardest. People who actually don't qualify for Medicaid or TennCare, but are able to purchase health insurance at an affordable rate through healthcare.gov. Those are the people who are going to be hurt the most.
So, Scott, one last thing here. What do you want folks to know about the role of the Church Health Center? Can they still reach out? Should they? Where do we go from here?
I mean, look, Church Health is not a federally funded anything. We're a true charity. And at the end of the year, this is, we have to raise $24 million to keep our doors open. We're going to be there to care for as many people as it's possible for us to care for. The only way to grow our ability to do that is through more financial resources. And so, at the end of the year, as people are considering their charitable giving, I hope Church Health might be on your list. Memphis is known as one of the more charitable cities in the country. Most of that money primarily goes to churches. So we need to realize that the only way that we can feed people, care for people when they're sick is going to be with real dollars. It's not just so much volunteers.
We need Memphians and Mid-Southerners to step up as they often do. Dr. Scott Morris,
Alex,
always good to see you. Thank you very much.
My pleasure to be here.
All right, short break. Back in a moment.